Everyone, or almost everyone, knows someone with diabetes. Diabetes is a disease in which an individual's ability to produce or respond to insulin is impaired. In 2015, 30.3 million Americans, or 9.4% of the population, had diabetes. Everyone is a possible target for diabetes, so it is important to know a little bit about it. There are 3 known types of diabetes, and each one has signs, symptoms, ways of diagnosing them, and treatment. The first type of diabetes, which was previously known as juvenile diabetes, is most common in children and young adults. Type 1 diabetes occurs when the body does not produce insulin at all. About 1.25 million Americans have type 1 diabetes, and an estimated 40,000 people will be newly diagnosed each year in the U.S. The cause of type 1 diabetes is unknown, but 2 possible causes could be genetics and exposure to viruses. Common symptoms include increased thirst, frequent urination, bedwetting for children who did not wet the bed before, extreme hunger, unintended weight loss, fatigue and weakness, blurred vision, and irritability and other mood swings. Type 1 diabetes is diagnosed by running the glycated hemoglobin, random blood sugar, and fasting blood sugar tests. After being diagnosed, common treatment includes taking insulin, frequent monitoring of blood sugar, eating healthy, exercising, and maintaining healthy weight. I first learned of this type of diabetes at a very young age. One of my childhood friends was diagnosed with type 1 diabetes at the age of 5. His case was very severe, and he began having to take insulin shots often. The second type of diabetes, which is also the most common form of diabetes, is type 2 diabetes. Type 2 diabetes is a chronic condition that affects 422 million people worldwide. This type of diabetes occurs when the body does not use insulin the right way. The cause of type 2 diabetes is also unknown, but risk factors include age, race, overweight, inactivity, family history, and gestational diabetes. Type 2 diabetes has many of the same symptoms as type 1 diabetes, but you also notice slow healing sores and frequent infections and areas of darkened skin. To diagnose type 2 diabetes, they use the glycated hemoglobin, random blood sugar, fasting blood sugar, and oral glucose tolerance tests. After being diagnosed, treatment for type 2 diabetes includes eating healthier, exercising regularly, monitoring blood sugar, insulin therapy, and possibly medication. Many of my family members on my dad's side have been diagnosed with type 2 diabetes. There have been many times on family trips where we have had to stop and take care of these family members or make sure that they eat on time because it could get really bad if they don't. The last type of diabetes is gestational diabetes. It occurs during pregnancy, usually during the second half. In gestational diabetes, the placental hormones provoke a rise in blood sugar to a level that can affect the growth and welfare of your baby. Gestational diabetes has no noticeable signs or symptoms. It can be diagnosed by performing the initial glucose challenge test and the follow-up glucose tolerance test. Treatment for gestational diabetes include monitoring blood sugar, maintaining a healthy diet, exercising, taking medication, and monitoring your baby very closely. Although this has not happened to anyone in my family, I have had friends whose family members had gestational diabetes. It's not usually severe, but it is good to keep an eye out for it, considering it could harm your baby if you don't. The 3 types of diabetes are type 1, type 2, and gestational diabetes. Anyone could be a target for type 1 and type 2 diabetes, and gestational diabetes is only common in pregnant women. The signs and symptoms for type 1 and type 2 diabetes are very similar, along with the diagnosis and treatment. Are there any questions? Thank you.